This week, the president's health care plan got a huge blow. Aetna announced it would stop selling health insurance on public exchanges in 11 states. Aetna is just the latest health care provider to leave the system. Bruce sat down with a doctor to tell us what that means for you.
Carolyn, the program's in its fourth year and showing its limitations. Is the Affordable Care Act in trouble?
Well, it needs to morph. And the problem with the Affordable Care Act is that it did not do anything about cost control. And because costs are going out the window, insurers are trying to step back on the exchange-based plans. So the exchange-based plans are in trouble, but the Affordable Care Act in a whole is doing great.
And we saw, Aetna just in the past week and a half, said that it's going to distance itself from the plan. The exchange is open November 1st, and as far as the consumers are concerned, fewer options and higher prices. How do they best navigate the maze?
Well, most people don't even have to worry about the exchange. Most people are still covered by their group coverage at work. Most people don't make significant money, so amounts over 400% poverty level, don't need to go to the exchange. They still have lots of choice. So it's only the few people that have to actually buy their health insurance on the exchange they're going to see changes and reduction in choices.
So for those companies that are still with the exchange, how do they set this up so they can compete with private insurers? Do they need to increase government subsidies? Are there potential fixes here?
Well, one of the things that forgot to be mentioned in the Aetna coverage is they had $790 million in net profit. So they complained because they lost $200 million from the exchanges, but overall they're still making a very healthy profit, and that's from the private exchanges and from group health insurance. So the other providers, which will still have 4 other providers on the exchanges in Jacksonville, are stepping up and will be providing the coverage.
I don't want to get political here, but Hillary Clinton has one vision.
Right.
Donald Trump certainly has another.
Right.
Does that tell us that there is some change on the horizon, and depending who gets into office?
There will be change regardless of who gets in office, just because the law has to morph. With Hillary Clinton, she's going to try to fix some of the things within the law. Hopefully, the problem with the law is it is very complex. Donald Trump would want to repeal the law, and there's a lot to repealing the law because it's more than just about health insurance. And he would put the traditional Republican plans in place that they vetted in the past.
Carolyn, appreciate your perspective. Thank you for being here.
Thank you.